I'll be happy to give a short introduction to the IUHPE position statement on health literacy. And so I don't know if I have been properly introduced, but I'm Stephan van den Broucke from the Université Catholique de Louvain in Belgium, and also an executive board member of IUHPE. So what I'm about to do is to give an introduction, not on health literacy in general, but a little bit positioning where the position paper has been has come from, and to then look a little bit into the proposals that are being taken up there. So I think it's important to state that health literacy, of course, is not something new. So despite the fact that we have that we see now an incredible interest in the concept of health literacy, I think it's good to understand that we are basically building on something which already existed before. In fact, it was more in the middle of the 20th century that the idea of being literate has originated, meaning to be knowledgeable, to be educated in particular field. And I now hear a baby crying somewhere. So it means that the idea was already coined in the middle of the 20th century, and mainly also pushed by UNESCO, so it doesn't come out of the health sector. And gradually, the idea of being knowledgeable, educated, was expanded to look into the necessities, the capacities that were considered important to understand and function in a world that's becoming increasingly complex and difficult. And it's only towards the end of the 70s that it's also been mentioned in context of health. So it's not a new concept. It's already around for a while. But what we have seen in the last decade or so, or maybe two, is that it's expanded in scope and meaning, that there is an incredible explosion of research, and last but certainly not least, and also the reason for this position statement, an emerging political interest. Now, to give you a little bit of a feel of this expanding scope and meaning, I think we are now beyond the idea of health literacy being mainly something to be found in the medical context, in the context of health care. It's of course still important within the context of medical care, but we have seen that it's also been expanded to competences that are relevant for disease prevention and health promotion. So in addition to what one now would call medical health literacy, we also see public health literacy. So we've seen an expansion of the domain, and of course for health promotion, that's quite important because it's taken us out of patient education towards more public education. But that's not all. We also see that health literacy has expanded from a very functional concept, like reading and writing and understanding difficult terms in the medical context, towards more interactive and critical health literacy. So much more the capacity to make decisions, to be able to find information, to understand information, to think about information that one finds, to communicate and to ask for clarification. So there's a wealth of skills that we nowadays consider important to function in the world of health. And that is now the way we also consider health literacy. And it's also the way that health literacy has been defined or is increasingly defined. And the definition that is more and more used is also the one that WHO is embracing. And that's also taken up in this very interesting publication of WHO, Health Literacy, the Solid Facts from 2012. I think it's important to really see the dimensions of health literacy coming back there. So it's definitely knowledge, motivation, and especially competences to access information, to understand information, but also to critically appraise it, evaluate it, and to apply it. And that not only in the context of being sick and in the medical context, but also in disease prevention and health promotion, and of course with the ultimate goal to make decisions. So we see an expanding of the concept from medical to more public health and health promotion. We've also seen an explosion of research. If I tell you that the first research articles that mentioned health literacy in the 70s were just a handful, and before 2000 there were maybe 100 publications or a few more that appeared over the years. But nowadays, when you look in PubMed, you'll find more than 8,000 publications that have health literacy as a major term. There's more than 1,000 publications coming out per year. So the majority of publications is coming out in the last few years. And so it really shows the interest of the research world in health literacy. This is not only in PubMed, but also in Scopus and Google Scholar. Even this year, we're only March, or not even the end of March, and there's already 2,800 references in Google Scholar that mention health literacy. So, of course, Google Scholar does not only contain publications, but it shows an interest. It shows the interest that is very wide. And so, why is this such an interesting concept that triggers so much research? I think there are mainly 4 very important reasons for that, and this is also coming back in the position statement. It's, of course, health literacy is an important determinant of healthcare use and the related costs. So we know that people who have low health literacy will be more likely to inappropriately or less effectively use the health services that are available, and this applies both to the medical care, but also to the prevention care, vaccinations, screening participation, and the like. So time and again, we find that health literacy is a factor that really defines the appropriate use of health care. And that, of course, also has a cost factor. There are not that many studies yet, but they are beginning to emerge that show the actual price of low health literacy. And this varies, of course, from country to country and from case to case, but it varies between a few $100s per person per year to several thousands per person per year. And this is a result of the fact that the available services are not used effectively. Not only that, I mean, of course, health costs and economy are important factors to determine the political will to act on health literacy. But if you look at the health outcomes, we see again that people with low or insufficient health literacy not only feel less well, but also are less well in adhering to the guidelines of doctors and other healthcare workers, but are also less participating in behavior that helps them to develop a healthy lifestyle. So again, time and again, we find that health literacy is a factor that really is linked to health outcomes. And that, of course, is interesting also from the point of view of health promotion and health education. Health literacy can actually be seen as the most immediate outcome of health education, which in itself is a strategy of health promotion. So in a way, as an indicator of effectiveness of health education interventions, it's actually a very good indicator, very good concept, because it doesn't have the disadvantage of being also influenced by many other aspects. So I think this is also an element to be considered, and it is also considered in the position paper. And then last but not least, there is a possibility that health literacy is a mediator of the relationship between, on the one hand, low socioeconomic status and societal differences and inequalities, and on the other hand, the health disparities that we all know are there throughout the world, and that we are now facing in public health for a long time, and we can't really find solutions to it. The benefit or the interesting point of health literacy is that it is more amenable to change rather than the more social determinants. Now, I am not saying we should take away the attention from trying to change the social determinants of health. I think we should continue to do that. But I think in the meantime, we can also try to act on health literacy, because there is an emerging literature showing that health literacy can and does act as a mediator of those two forms of inequality. So it helps us understand why social determinants or social factors translate itself on themselves into health disparities. So these are a number of reasons why health literacy is considered important, and of course that means that also the politicians pick this up, and we see that at various levels the interest in health literacy is rising. The United Nations, for starters, the highest political level, if you like, considers health literacy important for the achievement of the Sustainable Development Goals. It is literally mentioned in the third Sustainable Development Goal about health for all. The World Health Organization, of course, also embraces health literacy in that context, and this at various levels again. Health literacy was one of the 3 priorities of the 9th Global Conference on Health Promotion in Shanghai in 2016, and it really positioned as one of the key elements to work on in the years to come. And at regional level of WHO, the European region placed health literacy also as an important priority in the strategy document Health 2020. This high level of political interest translates into national level interest, and you see more and more countries around the world that are recognizing the importance of health literacy and are developing policies to address low health literacy. And this is exactly what the IUHPE also wants to act upon and to reinforce. So there is more and more also an understanding that existing policies can also foster health literacy and thereby also foster health. So what can you do to address low health literacy? There's basically 3 ways to work on that. And if you conceive of health literacy as the place where skills and abilities of people meet the demands and the complexity of a health system, and a health system in this case is very broad. It means prevention, health promotion, and care. Now, what we can do is to consider health literacy as an individual set of capacities, of competencies, to measure them and to try to improve them. So this is what we have been doing for quite some time through health education. Health education leads to better health literacy. So continuing to invest in health education, both in the basic education in schools, but also for specific groups, specific vulnerable groups, is definitely important. Secondly, it's important to look at the fit between the available competences and the demands. And this is what can mainly happen within the healthcare sector. So try to assess the available competence of people, patients very often, but also trying to then improve and adapt the communication so as to make sure that that people understand what has been said and what they need to understand to manage their health. And then last but not least is to try and to reduce the demands of the system. And in this case, this means to make health organizations like hospitals, but also health insurance funds and other organizations where health is available, to make them more accessible and more easy to navigate. So to reduce the necessity to have very high skills and abilities for health literacy. So these are the 3 possibilities that we have, the 3 strategies. And so in order to address them, I think together with the IUHPE, I think we need to have a shared responsibility. So it's not only a responsibility of the health sector, it's also a responsibility of civil society and obviously also of policymakers to act upon low health literacy. And this is exactly what is now being positioned in this position statement that has come out, the position statement on health literacy that the International Union for Health Promotion Education has published. Diane Levin will go into this a bit more in detail in a minute, but basically it's come out of the work from several people across the globe that are united in the Global Working Group on Health Literacy. And so the idea is to really have a basis, a text that is a basis for discussion and advocacy, which can be used both within health promotion, but also outside the health promotion community. So also to involve other stakeholders, other partners to act on health literacy. And in that way, it offers an introduction to the concept of health literacy, more or less of what I have been talking about so far, but also calls for global action to improve health literacy at population level. And that call for global action can be divided in 4 action areas. One looks at policy, and that's a very important one. The second one looks at how we can continue to develop interventions to improve health literacy. The third one looks into measurement and research. And the fourth one, the last but not least one, is capacity building. I'll just list them very briefly, and then I think we could give the floor to questions and to discussion. So what are the key points? Well, basically, more or less covered in the previous parts of the presentation, I think we can conclude that health literacy has a great advantage to it as a concept because it's observable, it can be measured. We begin to have good tools to measure it at population level. And it can be considered as an outcome of health education and health promotion interventions. And we know that health literacy, that high levels of health literacy can be supporting actions to improve health, to improve prevention, to better manage health, and to be influencing other health decisions throughout life. And so that's basically the link with health promotion as well. So the action areas are 4, as I mentioned. So the first one is health literacy and health promotion policies. So one of them is to make sure that we promote not only working and acting on health literacy as a concept, but also to look at the systems approach. So meaning that we move beyond the medical and functional approach of health literacy, but we look at the more broader and more encompassing definition of health literacy, which includes also the critical dimension, which includes also the communication dimension, and which includes also decisions about health that are not typically involved in the care sector, but that are also broader in the society. And that means that we also have to make sure that health literacy is included at the global, national and regional policies, and that we try to promote health literacy to be included also in strategies for health promotion and social determinants of health that are being developed. With that, we also have to be aware of the fact that health literacy is flexible and variable. So it depends also on the context in which we operate. And that is not only nationally defined, but also, for example, the stage across the age, across the life cycle, and also in specific groups where we work or might work with. So recognizing that health literacy is not one size fits all, but that we have to adapt also to the context. So this is what is really one area that is highlighted and emphasized in the position statement. With regard to health promotion interventions, the position paper also states that we should not only consider health literacy as an important outcome of health education and health promotion, but also in itself as a way to empower people. So it helps people and communities to empower. And so we have to view them in a wider context again. So again, within the healthcare sector and patient education, but also to prevent and manage ill health. We also want to highlight the fact that we need more research. This is, of course, very often stated in academic media, but I think it's very important that we provide the evidence base for health literacy as a way to continue investing in it. And I think we can be quite specific on where we should invest. I think we should, of course, continue to invest in measuring health literacy and developing appropriate tools. But I think more than that, I think we should use those tools to monitor change, also at population level, and to also link health literacy to the social gradient. And so, for example, there are there is a project now being put in place in Europe where we are going to try to monitor the changes of health literacy in the population in different countries, and to try and use that as a tool to base our decision and to also monitor changes and policy, the effects of policies with regard to health literacy. We should also look more into the idea of organizations and settings that are health literate or that help to be health literate or that accommodate for health literacy. So I think we should not stick to the view of health literacy as being an individual capacity, but also look at the more systemic views of health literacy. And then another aspect that within the years to come is gaining more and more importance is to look at other health literacies, more in plural, including digital health literacy, because we live in a world that's becoming increasingly digitalized, and that means that also there we have a contact between, on the one hand, people with low health literacy, but also with low digital health literacy. And so to navigate information about health in that context is getting increasingly difficult and calls for specific competencies on behalf of people. So this is also highlighted in the paper. And then last but not least, all of this requires, of course, that we have people, that we have specialists and professionals who know about health literacy and who know how to work with health literacy. So within the paper, we highlight the fact that we should build the capacities of the health workforce to work on health literacy. So that means to place health literacy high in the training and education curricula of those who will work in health or who work in health, and to make sure that it gets the place it deserves. And that again means that it requires a collaboration with various stakeholders, and that we should also learn how to work with the other stakeholders. So this is, these are the 4 action areas and the recommendations, the avenues that are being highlighted in the position paper. And I think with this I'd like to conclude. Health literacy is not just about reading and writing. It's not just about understanding what the doctor says. It's about the way we act in life, and it's about the culture we are within. It's also about our professionalism as health workers and the way we look at life of ourselves and also of others. So thanks.
So hello everybody. I don't have that much more. This is Diane. I've had the pleasure and the privilege of being a founder, co-founder, and co-convener of the Global Working Group on Health Literacy of the IUHPE. I'm calling from Tel Aviv, and my day job is to direct the Department of Health Education and Promotion for Clalit, Israel's largest health service organization, and an associate professor of public health at the School of Public Health, University of Haifa. But just in the capacity of the Global Working Group, first of all, I'd really like to thank Stephan for a wonderful, wonderful presentation. He covered it so perfectly, and the orientation is really very, very thorough that he's given us. So all I can really add at this point is that I'm just very thrilled that it's been published, it's been released. Thanks so much to the headquarters, to Patricia, Natalia, and Diane, and for all who've contributed. The Global Working Group is a group, as you would understand, it's from all around the globe. We're a group of experts, professionals, researchers, advocates for health promotion, and particularly health literacy. And we work together throughout the year to promote health literacy through our connection in IUHPE. So we have produced this position paper, which took several years. You may ask why it took several years, and it's because we're, as the concept has been developing, as Stephan has said, that we have been following the concept as it's developed. We've kind of developed this position statement, adding to it as the concept and as the attention to the concept has developed. And as you could see, for example, the digital health literacy was added in the past year or so as we realize how important it is. So the concept's been evolving, the position statement's been evolving, and we're very grateful for all who've given the input. We really hope that this will promote policy, promote research, promote practice, and it will be a thought piece and an action piece for advocating for health literacy. So with that, I'm happy to give the floor back to Linda. Unfortunately, I can't hear anybody other than Stephan at this point. And so I'll just watch the chats. But at this point, I'm also very happy to say that we are welcome to other members of the Global Working Group. It's an informally managed group, and anybody who wants to contribute and participate is more than welcome. And we're looking forward to more discussion about this. We're having a pre-conference in the global, at the World Conference of Health Promotion in New Zealand next month. So any of you who will be there, we, of course, would love you to join the pre-conference. It'll be on Sunday, just before the opening, and we have lots of sessions throughout the conference. So I'm looking forward to hearing the discussion, or at least seeing the discussion on the chat. And thanks once again for Stephan for the wonderful orientation, and also for Patricia for working out all of the technical and logistic aspects of this webcast. And of course, thanks to Linda for agreeing to moderate. And I'm here online. I'll be watching the chat, and hopefully I'll be able to hear some of you at least. So thanks again. One thing I would like to add is that as you could probably see if you've read the document, it's something that has to be a living document. It has to be a living tool, so that as different countries will be working out their national work plans, we will also be updating the position paper to give them exposure, to give support for others. For example, I understand we wrote that Canada had a work plan, but apparently we were just so impressed by Canada's work and the surveys and all the reports that have come out, and we're looking forward to a work plan from Canada as well. We understand that one of the provinces is working out. Floor back to you.
Thank you, Diane. Merci, Diane. Okay, I said I'm going to keep my comments super brief. The only thing I would like to say, and thank you, Diane, for saying this is a living document, because I had noted that Canada does not, in fact, have a national policy. What we have done in Canada is to produce a lot of reports and a lot of excellent frameworks for policy, and we do have a lot of activity going on around the country, but there is no such thing as a federal policy. At the moment, there is tremendous activity here in Quebec. There is a politique gouvernementale de prévention en santé that does have a component to develop a strategy for health literacy. So I think we're particularly excited that IUHPE is now located here in Quebec at a time when Quebec is taking this route. So hopefully we will have something to say in the future, but there is a lot of activity across the country. The only other thing of interest is that for the last 30 years, Canada has followed a slightly different trajectory. We actually started out by looking at literacy and health, and we took a public health perspective from the beginning. We only began to shift to health literacy in the early 2000s and to integrate the medical side. So our trajectory has been somewhat different from other countries. Having said that, I would like to open the floor to discussion, because I want to make sure we have time for Stephan and perhaps Diane and anybody else who would like to respond to questions people are sending in. Patricia, you...
I can moderate, so anyone who has questions can type them into the chat, and we'll share them with the room.
Correct. Still, is there still difficulty hearing me?
I can hear you very well.
You can, yes. I'm not sure. Okay.
There was a question well back in the beginning regarding that question.
So the question is, in terms of special populations, is there a bank of materials for best practices around the EU and beyond that can be accessed? And I guess either Stephan or Diane can respond to that. Stephan, do you want to start?
Well, there's no bank as such, but we try. There is, of course, a wealth of experience in good practices, and sometimes this is being gathered. And I know, for example, with respect to elderly people, that there has been a very informative project that has been able to gather interesting experience, not like in a research, but more like intervention-wise. And so this is an important way to move our knowledge further. But as far as I'm aware, there's no information bank that systematically has all that information with it. But I think it's a good idea to take that further.
Hi.
Diane, do you want to comment as well?
Yes, thank you. It's a great question. Firstly, I think it's important that we also mention the Boston University School of Medicine tool shed for health literacy. It's kind of a clearinghouse, a website that has many, many different tools for measuring health literacy. It's mentioned in the position statement, so you can go into the tool shed and look at the different measures and different tools there and see what might fit your context, your country, your culture. That's mainly for measuring health literacy, but also there's been, the past couple of years, there's been more and more publications. A book that came out on health literacy in context, where there's a chapter on culturally adapted health literacy, written by Jane Willis and myself. Also, there was a special edition of the International Journal of Environmental Research for Public Health that came out a couple of months ago. And there are several papers on culturally adapted health literacy and cultural appropriateness. And also there's a handbook of International Handbook of Health Literacy coming out in about another month. And also there'll be chapters on that. So within those publications, there's rich bibliography that can hopefully help, that can help for you to reach the best tools and research and practice that suits you.
Okay. I'm going to ask s'il y a des questions ici parmi les participants poser à Stephan ou Diane. Hello.
So this is a position paper. So what's the next step or steps for action?
Okay, the question is, after this position paper, what do you see as the next steps for action?
Okay, shall I? Okay, I'll give my input, and Stephan, of course, and others. We want to take it to the next level, and we want to see how we can help put these action points in action. And we're going to be meeting about this in April 6th in New Zealand, and throughout the week there we're going to try to give as many recommendations as we can. It's an excellent question, and I think part of it we have to put to the different countries that are working on it, also the different partners that we have. As Stephan mentioned, the WHO, the World Health Organization, has been promoting health literacy lately. We're going to keep a close eye on what's going to go on, and we're also supporting the World Health Organization in the different regions because they are trying to put policy positions into place and also to promote action. For example, they've established an NCDs, a non-communicable disease network across the globe, and they put health literacy center stage, and they're looking for best practices, and so we'll be supporting them as well. So some of the action points are already taking place, and others we really have to promote. I think the best thing is that people, all of you, and anybody who you think can use this position paper to distribute it and use it as a support when you're making your case for health literacy, when you want to incorporate health literacy in your health promotion, research, action, practice, and policy. I use it as a support. So I think we're really working on the next steps, and they're going to be going in different directions in policy, in research, and in action. But the best thing is that we have the IUHPE to bring it all together. And also we'll be talking with our partners in other global working groups. Global Working Group on Salitogenesis, Social Determinants, Health in All Policies, to see how health literacy can support their work as well. So, and maybe the answer is pretty general at this point, but we're very keen on promoting all those action points.
Okay, thank you. Diane, I think, would like to make a brief comment, and then we will continue with questions.
Yes, just to add to the list of resources and publications available on the topic, I just want to highlight that IUHPE's journal, Global Health Promotion, had a special issue in December of 2018 on health literacy. And in that journal, you also find the position paper as a whole. It was published in there. But it's also on our website, and there are summaries and 3 languages, I believe.
And it includes one article on the Maori and health literacy, which connects with the next question. In fact.
Yes, it can, because the next question, of course, is from Bernice Downey. I've been working in the area of Indigenous health literacy in Canada. Has there been any consideration of this issue at the global level? Stephan, do you want to comment? And then we'll go to Diane.
Yeah, I think this is exactly what a very good illustration of the need to consider health literacy in context. And so that's one of the points that's highlighted in the position statement. I think we have to look at the various situations. In Canada, this might be the Indigenous people. In Europe, we have more migrant people. And I think we have to also look at that at each time. Not one size fits all, but really look at how we can work with health literacy, with people within their context. So yes, there is consideration for that, but it needs to be translated each time from the global and international level to the more specific local level and the needs that are being voiced at local level.
Thank you. Broucke is saying perhaps at some point we can look at comparative healthcare systems, because in many countries we see the so-called falling apart of healthcare systems. So it's hard to do a nationwide successful intervention. We need to focus on smaller projects. Any comments from either of you on that approach? Go ahead.
Yeah, I'm happy to comment. One of the ways in which that we're relating to the notion of health literacy is acting locally. It's acting globally, acting nationally, regionally, but also locally. So even when health systems are changing, I don't know if they're breaking down and being put together again like Humpty Dumpty, or if they're just changing, but we can always rely on the community to be a really active context for improving health literacy, and also looking how health literacy is supported by not only the healthcare system, as Stephan was so eloquent about that point, saying the educational system and other systems as well. So when we look at the way in which the healthcare system is a player, it's only one of the it's really only one of the players in the whole arena of those partners that are affecting health literacy, that can promote health literacy. And also we have, and thank you so much, Leanne, for mentioning the special issue. I just assumed that it was mentioned before, but the special issue on the Global Health Promotion Journal that is dedicated to health literacy, that was edited by Don Nutbeam, Gillian Rowlands, and myself. There are several of the articles that also talk about health literacy, not only within the healthcare system, but in other systems as well. And I do believe that the healthcare system can only benefit, even when it's changing and perhaps, in a sense, changing the way in which it works, if you want to call it falling apart or just reorganizing. Health literacy can play a major role, because we really want to work on empowerment. And this is one of the important ways in which empowerment happens, is working through health literacy. So empowerment of people, whether or not the health system is going one way or the other, helping them work on their own health is really one of the most important basic tenets of health literacy. So I think it's there in any case. And people want information, people want tools. People in general want to promote their health and are looking for ways in which the information or other tools can help. So the healthcare system, it's there for them as much as it can be, and we have to look for other systems as well. And I'm saying that having worked, and I work in the healthcare system.
All right. Est-ce qu'il y a des questions ici? Okay, what can be considered a health literacy initiative? Chantal is asking, and I should mention that Chantal is doing research on the current strategy here in Quebec. So the question is coming from deep knowledge and an open mind. For example, fact sheets that are simplified. Are we talking about health literacy? If we consider empowerment an aspect, do the target audiences have to be included in the process? Stephan, do you want to start with this one?
Yes, Yes, of course, I'd like to answer this. I think the variety of what we call health literacy initiatives is enormous. And it depends on whether we're talking about the more functional aspects, and then I think a fact sheet would definitely be in place for that. But I think we have to take it beyond the explaining and making it more understandable what we have for messages. I think we should also foster more critical thinking and really help people to analyze the information that they have. I think one point with regard to health literacy that's really important is that probably the biggest problem is not for people to find information, and maybe not even to understand information, but to find their way in the information that's available, because we have a wealth of information, and I think the critical skill is to know which one can be tapped and can be used, which one is actually reliable. And for that, I think we should go beyond explaining what we think is right, and I think we should go towards really meeting people's needs in terms of information. And in that respect, of course, we do and should include target audiences. I have a little bit of a difficulty with the term target, because it's already meaning that there's a difference in who's acting and who's not. I think we should collaborate with those people that we're working for, not only in terms of what kind of information they need, but also in terms of the way in which we can provide the skill training that they are demanding for. And I think there's some interesting experiences building up there as well, using co-creation approaches to consider the needs in terms of health information that people have, specifically in deprived areas.
I'd also like just to add to that, if it's okay, and definitely agree with Stephan about the importance of critical health literacy. I think there's two other points that perhaps can help support that. We're looking at health literacy across the lifespan. So interventions and ways in which we will promote, and we promote health literacy, of course, is in the context of where people are in their life stages. So it's important to take a look at that. And also interactive health literacy. We want to be able to help people promote their skills and support their skills in expressing their needs for whatever they need for health and health information and health tools, so that when we're becoming more and more interactive digitally, and also be able to engage better with their healthcare system, to express their needs and to be able to seek out what they need and have the confidence to do that. That's a very critical part, we think, of health literacy as well. So we're looking at functional health literacy, critical health literacy, and interactive health literacy. And much of what we can do to promote health literacy is the result of intervention in health education and promotion.
I want to go back a little bit to the question of empowerment, because again, involving the audience in the process. There's a comment here from Bernice again about empowerment in Indigenous peoples, and that the aspirations of self-determination are closely linked. One of the things that Canada has actually done very well is to produce a set of research guidelines for working with Indigenous populations. And I spent a week last week in Ottawa reading proposals that were being submitted for funding from the Social Sciences and Humanities Research Council. A large number of them were focused on Indigenous research, and one of the principles of precepts was that no research about us without us, that there must always be an inclusive participatory process, and the voices of the people who are being studied have to help shape the project. So Irv Rootman has made a comment saying that Health Promotion Canada is working with the Secretariat here to initiate a project on Indigenous health promotion and competencies. He's saying that could include health literacy, and wondering if Leanne might want to speak to that. I mean, I'm assuming that it would take account of the principles that we're talking about.
Yes, I don't want to say too much because we're running out of time, and also it's a very early on in that project. But I think that when we're talking about increasing the capacity of the workforce in health promotion, and with health literacy being an important action area highlighted in the position paper, we would indeed do very well to incorporate talk about health literacy and engagement of the folks with whom and for which we are working, reflect on that. But thank you for the comment, Irv. I think it's a good link to make in our official proposal.
Now, I think that we're at a point where we need to say thank you, am I correct, to both Stephan and to Diane for the invaluable presentations this morning and the openness to answering questions.